Hello and welcome to This Week on Q. I'm your host, Derek Lambert. Joining us this week is a representative from Quincy Medical Group, Joseph Poyser. Poyser is a licensed clinical professional counselor and has joined the behavioral health department at QMG. Before coming to Quincy, Poyser has worked in residential and integrated treatment areas in the Chicago area. His clinical interests include working with adults and emerging youth with substance abuse issues, dual diagnosis, mood and anxiety disorders, LGBT populations, and overall health and wellness. Joseph, thank you for coming in and joining us today.
Thank you for having me.
Glad you could take a couple minutes out of your day and come down.
Yeah, no problem.
I thought it'd be good, we're kind of in the heart of, sickness season, for lack of a better word. Do you think, kind of the winter blues have an effect on the overall health of, students or just people in general right now?
Well, people in general, yeah, seasonal affective issues are common in the winter months and during really peak seasons in summer actually as well. So you have seasonal affective disorders kind of are prevalent in winter months where you're not getting enough sun light, especially common in higher northern states compared to like Florida where 1% may have them.
Right.
So the sun plays an important role in how we actually function. Less sunlight, you're not getting the vitamin D. Vitamin D is important for whole serotonin, any of those neurotransmitters. Without it, you're not getting.
So the Midwest, where the weather, isn't
gloomy.
great during the winter months,
Yeah.
has an effect on that. Could you talk to us? Is there a connection between mental health and then just your overall physical health as a person?
There is depression, anxiety can all have an impact on your physical health. Just dealing with any type of depression, people who are depressed actually have higher instances of problems with obesity and cardiac issues.
Okay.
So they do play a role. Is it causal? Not so much, but there is definitely a significant role in how healthy you are mentally can have an effect on physical health. If you're not wanting to get out, you're not going to be as physically healthy.
Right. So do you, at Quincy Medical Group, do you work hand in hand with other, doctors or, you kind of talked about obesity, so maybe, trainers of some sorts when, say you're dealing with a mental health issue, and kind of correlating between the two of you?
We work with dietitians as well.
Okay.
So dietitians making sure that they're getting the proper nutrients and healthy diet in order to kind of, we do take the integrated approach. Doctors are overseeing that, but dietitians, behavioral health, not everybody wants to eat healthy all the time.
Right.
So really making sure we get to kind of issues where, why aren't you eating healthy? What keeps you from making the smarter decisions? And which plays an effect. If I'm depressed, that chocolate bar is going to look better than, say, some kale salad.
Right.
So.
Well, I think even if you're not depressed, a chocolate bar sounds a lot better than a kale salad. But could you kind of walk me through what some of the resources are if there are students on campus that are struggling with mental health, maybe specifically depression, and different things like that?
Well, come see us. We're at QU Counseling Center. We're there Monday through Friday. Monday through Thursday, we're there from 8 to 6. And Friday, I am there from 8 to noon. So it's a good resource. We can help you out with depression. If we think that you need more significant help, we also have the clinic right next door. Tiffany is going to work with you and kind of make sure if you need something, a mood stabilizer, she can get that for you.
Right.
Which is different than in the past. And if we really think you need some sort of higher residential or inpatient, we will make that suggestion.
And so you said so you're not by yourself.
I am not. I have a counterpart, Millie Silver. She just passed her licensing exam.
Okay,
so
good.
She's going to be a LCSW, a little bit different, but we both are there to provide counseling services.
Awesome. And so if there is a student on campus who maybe is struggling with depression, but they, small campus like QU, they want to keep it a secret, or, they don't want to make it as, open of a, they don't want to make it a public deal. What kind of advice would you have for them, and what kind of resources specifically for that angle do you have?
So if they're not comfortable with coming to see us, but once again, our whole strife is ensuring confidentiality. So if we're not going to tell anybody that you're there. It's your business. We try to maintain confidentiality, and there should never be a breach, let's say, unless you sign a release of information.
Okay.
So understanding that, yes, there is a stigma towards mental illness, but coming to see us or seeking online resources, just kind of tipping your toe in the water, kind of self-help books are effective as well.
Okay.
But really coming to see a professional is usually the best. And you get free sessions as long as you're a student. So
Well,
for
that's
however
good.
many. Yeah.
Do you know, are there other opportunities maybe at the Quincy Medical Group location in Quincy? Maybe, so not necessarily on campus, but at the...
They are certainly welcome to come and see another therapist or come see us. Services won't be free
Right.
at that point, but if they do want to get off campus, they certainly can come see us at our main location.
Good. You know, another question that I have for you is, you know, could you talk about some of the signs of someone who maybe might be depressed or another, you know, typical mental illness on college campuses? So if someone is around you in class that you think, you know, might have these signs that there might be something going on, and maybe if they're a resident assistant or something or a mentor on campus that they see these students going through these symptoms or these, you know, I don't want to say triggers, but almost triggers that would say, all right, I need to, you know, maybe recommend them talk to somebody or something like that.
Yeah, and it's important to make the distinction between actual mental illness versus I'm just not feeling very well. We're looking at weeks to months of symptoms for diagnosable disorders. So if you are noticing people really pulling away, isolating themselves, eating habits, sleeping habits are way off. Irritability is a big one. They're just not the same person as they usually are. Moods have been changing, then usually there may be something else. And if anybody has made comments of, oh, you know, I'm wondering about if I'd be better off dead or thoughts of suicide, that is definitely a sign of there needs to be action taken.
Right. Okay, good. Thank you. Coming up, we'll discuss some potential contributing factors to declining health among college students. You're watching This Week on Q.
Join me, Coach Marty Bell, head basketball coach of the Quincy University Hawks, live from Chicks on the River every Monday night at 6:30 p.m. or on ESPN 1440 for the Coach Marty Bell Show. Hear from our coaches and players as Ben and I recap the previous games and preview our upcoming opponents. Grab your friends and family and come out to Chicks on the River for a great meal and meet the Hawks. QU men's basketball, Chicks on the River, and ESPN 1440. A winning combination. And as always, it truly is.
Welcome back to This Week on Q. According to the National Alliance on Mental Health, 80% of college students feel overwhelmed with their responsibilities. What could be done by students to bring their stress levels down? What do you think kind of on that base?
So, I mean, stress management is not just a one-time thing. You have to practice it daily. So engaging in positive activities, some enjoyable activities that you like to actually do. Meditation, prayer can be effective. This is a Catholic university, so a lot of Christian students here. But exercise is especially important.
Okay.
You guys have a facility here on campus. I suggest using it daily. So.
Okay, good. So just kind of getting out and getting active, maybe just kind of, I think some people tend to isolate themselves in their rooms too, so getting out and being active would definitely help. You know, eating disorders have been a problem for many college students. Could there be a possible connection between a student's mental health and their diet? We kind of touched on diet earlier.
And there is, and again, eating disorders are different than disordered eating. A lot of college kids have disordered eating just because of the nature of college. They're not getting the best food choices available. They're not going out to the grocery store. They're given what they are given, and that's it. And that can affect mood. You're seeking oily, fat high sugar foods, not going to be the best for mood.
Okay. And I know we talked about it earlier. So if students are having any type of depression issues or things like that, they can come and talk to you. And get in contact with people at QMG, right? Now, what about the eating disorders? Since we're talking about that, is that something maybe not you specifically, but you as in QMG, Quincy Medical Group, could take on maybe on campus, or if that's something that they would have to go off campus for?
So we would work with a lot of motivational interviewing. If you're just having some issues, we want to get back on a healthy diet, things like that we can help you with. We do have a provider at Quincy Medical Group, Tiffany Rains. She's an LCPC,
Okay.
work with her. She does a lot with eating disorders. So
Okay.
if they want very clinical work with eating disorders, they could come see her.
Okay,
as well.
perfect. So there is somebody
There is,
specifically for
yeah.
that. Good. The National Institute on Alcohol Abuse and Alcoholism reports that 80% of college students drink, with binge drinking accounting for almost half of that. Do you think college students are turning to alcohol to deal with, we talked about stress earlier, so do you think people are leaning towards alcohol as something to kind of fill that gap with depression and stress?
That's a hard one. It's to do that causal relationship again, very difficult. Actually, a lot of kids have already come into college and they've already begun some drinking patterns that aren't so healthy.
Right.
So there is this college mentality, this social normalization that drinking is what you do on colleges.
Right.
So with the peer increase, everybody's doing it kind of mentality. Parents aren't there, some sort of guardian's not there to really look over as much. Binge drinking is going to happen more. You're going to have more events. It's more available.
Right.
So.
Maybe is this something that people could come to you specifically on the topic of substance abuse? Is that something you?
Yeah, this is something I'm very comfortable with.
Okay,
and,
good. Good. So that they'll be able to have that resource for you. The resource being you on campus.
Yes.
Good. We'll be right back for This Week on Q after this short commercial break.
QUTV is more than a news outlet.
1 in 5 undergrads work at least 35 hours a week, year-round.
Students involved with QUTV learn life lessons, create lasting memories, and gain the experience needed to succeed in future careers.
Students need to be involved with QUTV as a viewer or as a participant because we need to know what's going on around our campus.
Knowledge is powerful, and QUTV News serves to inform not only the students, but the Quincy University community as a reliable and powerful news network.
Yes. Growing up, I had one deaf friend, and that was the only deaf person I knew before coming to school here at QU. And now I regularly get to hang out and socialize with the deaf community, which has been awesome. Sign language isn't exactly like learning another spoken language because you use your body, facial expressions, your hands are your instruments. So it is definitely learning a new language. It has its own grammar and syntax and everything. It's not exactly like English like a lot of people think it is.
That'll be it for this week's show. Thank you again to Joseph Poyser for coming in. Could you just tell us one last time where people could find you or your counterpart on campus?
So we are in the Friars building, Francis Hall, or Friars Hall, and we're on the first floor, right around the security building, and right next to us is the clinic. So
okay, so you're all in one place.
We're all in one place. We're right there. If you're having issues with mental health, you can come see us, and then our physical health well-being is right next door as well.
Perfect. Well, thanks again for coming in. I appreciate it. So that'll be it for this week's show. We'll be back next week with more on what's happening on Q.